collaboration with the U.S. Department of Veteran Affairs, VA Center for Faith and Opportunity Initiative, CFOI. Uh, this is in collaboration with the Veterans Health Administration Office of Mental Health and Suicide Prevention. My name is Melissa Paulin. I am the Senior Outreach Specialist in CFOI, and I will be your moderator this afternoon. Everyone's phone will be muted. If you have a question, please type in the Q&A box on the right side of your screen. I will read the questions at the end of the presentation. This is a live recording. This presentation is not releasable. However, there are handouts available with this presentation from our office. First of all, I would like to thank Mr. Bradley Lantos, VHA, and his team for their collaboration on this event. We are grateful for your partnership. Now I would like to introduce Mr. Conrad Washington, the Acting Director of the VA Center for Faith and Opportunity Initiative. Mr. Washington is a retired combat Marine and served on active duty for 20 years. He's been with the VA since 2013. He is a licensed minister and a man of faith. Now I'll give you Mr. Conrad Washington.
Thank you, True. I appreciate it. Thank you all for joining us today. I know that people are busy with meetings and Zoom meetings and WebEx meetings. So we appreciate all of you, wherever you are in your places, joining us today. So again, I'm Conrad. I'm responsible for the Center of Faith here in the VA. And I want to share a couple of things with you before we turn the mic back over to True there. First, our office is located in Washington, D.C., and we're here to connect with faith-based organizations across the nation. We do that through webinars just like this. So I would encourage you that if you would like to connect with us to be a part of the VA pursuit to reach the 20 million veterans, either by having a webinar just like this, and we have a wide variety of subjects that we host webinars on, from suicide prevention to benefits for our veterans, to homelessness, survival assistance, and so forth. So we would love to connect with you and your organization that we can have another webinar so we can reach the veterans in your area. So we welcome you to reach out to us, and at the end, you'll get some contact information. With all that being said, I do want to share one other thing here, and part of that is that we have what's called a pocket guide, and the pocket guide is a document that we created so that the organizations across the nation can connect with us, and more importantly, they can start a ministry within their organization. And the ministry can be something as small as coffee once a week, to Bible study, or it can also be going fishing once a month, whatever it is. All we ask is that whatever organization it is, that they connect with us so that we may pour into you the VA benefits and resources. But we'll give you an opportunity to actually link up at the end for the pocket guide, so we look forward to that. So without further ado, we're going to go ahead and get started. Thank you all for coming. I also want to give a big applause for Brad Lanto for joining us. He's a busy man, as we all are here trying to do things. We appreciate you, Brad, for taking time out of your schedule to reach the actual people who are on the ground doing great things in the field, from faith-based organizations to pastors, clergy from all different denominations. So we thank you very much. And Ms. True, you have it.
Thank you, Mr. Washington. Now I would like to introduce to you Mr. Bradley Lantos. Mr. Lantos joined the Suicide Prevention Program as the Director of Field Operations on December 10, 2018. He is presently detailed in VHA as the Director of Partnerships for the Suicide Prevention Program in the Office of Mental Health and Suicide Prevention. Mr. Lantos is a licensed clinical social worker and a lieutenant colonel in the United States Marine Corps Reserves, who was brought back on active duty from reserves after September 11th for Operation Enduring Freedom, and served for 7 years before returning to the reserves in his civil servant position. Over the past 28 years, he has moved in and out of active duty and reserves, working logistics and behavioral health. He has worked as a civil servant and Marine at all levels of the United States Marine Corps, including the installation, Headquarters Marine Corps, and Headquarters Marine Forces Reserve. Additionally, he had served on active duty with the Department of Defense Reintegration Program and the Defense Suicide Prevention Office as the acting deputy director and military deputy. Mr. Lantos currently resides in Emerald Isles, North Carolina. And his free time, he enjoys surfing, paddleboarding, snowboarding, and spending time with his two kids, Zach, 21, and Savannah, 14. Now, without further ado, I'd like to introduce Mr. Bradley Lantos. Sir, I turn it over to you at this point. Thank you.
Thank you, True, and thank you, Mr. Washington. I appreciate the opportunity to come on today and talk to you. I'm going to, at this point, take control of the slides here and work through this presentation. So let's see. Okay, it's working good. Just wanted to frame suicide as a national issue. The rates are rising for suicide in the general population, and suicide rates are higher and are rising faster among veterans than among non-veteran adults. Our data is from 2017. It always lags about 2 years, so we will be getting the 2018 data here probably in the fall. But in 2017, 45,390 American adults died by suicide, including 6,139 veterans. Veterans accounted for 13.5% of all deaths by suicide among U.S. adults, but it constituted only 7.9% of the U.S. adult population. As a group, veterans are at elevated risk for suicide, and some subpopulations have a higher risk than others. For example, when we look at our transitioning veterans, they're at a higher risk. Our women veterans are at a higher risk, and then our younger veterans. The rate is 2.2 times, sorry about the slides here, forward slide. The rate is 2.2 times higher for female veterans than their civilian counterparts. And as you can see, the rate is 1.3 times higher for male veterans than their civilian counterparts. And we look at the age ranges, and looking at the 18 to 34 population, that's our highest rate, where we experience our highest rate of suicide. But in the 55 and older male population, that's our highest count of suicides. And that's because that population, the 55 and older population, represents the largest population age-wise in the VA. 69% of all veteran suicide deaths resulted from a firearm injury. So that's why there's a lot of work going on that we'll talk about around firearms and lethal means safety. And if we look at the veteran population, you can see that that the VA's official estimate of veteran population is approximately 19.8 million veterans in the U.S. Roughly 18 million of those are male veterans and 1.8 million are female veterans. And if we look at by service era, veteran population by service era, you'll see that the Gulf War era represents the largest population, with the Vietnam era right behind that. And we dig down into the suicide data from 2017. We looked at about 17 veterans died by suicide each day. And when we look at those 17, 38% had a recent VHA encounter in 2016 or 2017, about 6.3 suicide deaths per day. 62% had not had recent VHA encounters in 2016 and 2017, and that accounted for about 10.5 per day. And then also a population that's often not thought about, there are 919 suicides among never federally activated former National Guard and Reserve members, or an average of 2.5 suicide deaths per day. And we know with these numbers that, a lot of them aren't in VHA care or haven't used VHA care recently. So we need the nation's help to reach out to all veterans and identify those that aren't in care so we can offer services. When we look at suicide, it's complex. And we talk about the fact that there are some risk factors for suicide. that include prior suicide attempt history, certain mental health conditions, access to legal means, and stressful life events such as divorce, job loss, or death of a loved one. And we look at protective factors for suicide that include mental health care, feeling connected to other people, spirituality, and positive coping skills. These are characteristics associated with a decreased likelihood of suicide behaviors. And because there's no single cause of suicide, veterans are often experiencing difficulties or issues in several of the domains that you see on this next slide. For instance, a veteran may be having health or mental health issues, relationship problems, financial issues, employment challenges, as well as have access to a firearm, and they go on and attempt or die by suicide. One of the things that, when I was looking at this slide, I think we probably need to update it is to show the spiritual component, probably in the community domain, because it's extremely important, which we'll talk about today. It's long been contended that religion protects individuals from suicide, and much of our research has found support for this. I think, the group I'm speaking to today knows this better than anybody, but many faiths emphasize suicide as an affront to God, and you hear that thing, only God can give and take away life. Hope and meaning are common themes that we hear. God has a plan for me, He has work for me to do yet. We also hear the theme of faithful perseverance. It can show that not dying by suicide shows selflessness, discipline, and a strong faith to keep pushing forward despite the pain and distress they might be going through. Talking to God in prayer is a common and useful intervention when times are tough, and the social engagement of attending church and church functions can reduce isolation. Many churches offer support programs and volunteer opportunities to help others. So findings suggest that these protective factors help reduce attempts, but not ideations. Ideations or thoughts of suicide happen regardless of religious affiliations. It's the acting on the ideations that religion, faith, spirituality can help reduce. The main point of religious attendance, or a large part of it, is the social support and engagement it provides. And studies have shown that religious attendance without social supports and engagement does not reduce suicidality. And when we look at faith as a less protective factor, negative religious coping can increase suicidal risk for some, examples of which are feeling abandoned by God, blaming God for struggles, not measuring up to God's expectations, and losing meaning in life. Findings indicate that the absence of meaning or purpose in life is a robust predictor of suicidal risk. Findings also suggest that enhanced or diminished spiritual functioning is associated with suicidal thoughts and attempts among veterans dealing with PTSD. So this leads to the next portion of the presentation where we talk about a public health approach. We've been working on instituting a public health approach to suicide prevention in the VA for several years. Since I came aboard in late 2018, especially, we've been focused on this. Public health asks, where does the problem begin, and how can we prevent it from happening in the first place, upstream of the problem? And on the next slide here, our strategy combines partnerships with communities to implement local suicide prevention plans tailored to their community. We're also looking at instituting evidence-based clinical strategies for intervention and focusing on what we can do now in the short term before the end of the calendar year, combined with what we can do over the long haul in order to implement our national strategy for preventing suicide prevention, or preventing veteran suicide. And that national strategy, I know it's a link in this presentation right now, but it's available if you Google it. It's available as a PDF, and it's a great document to look at, especially if you're trying to develop a suicide prevention plan. This slide depicts what we're going to do through a bifocal lens. So our SP Now initiative is the vision for 2020. That's what we're going to do this year. And SP 2.0 is the long-term marathon. We know that it's going to take time. The Now plan, the one we want to accomplish prior to the end of the year, has 5 planks aimed at 19 strategies to get after suicide. It's a low-hanging fruit that we feel we can affect in the short term, such as increasing lethal means safety, as I talked about earlier, initiatives and education on that topic, increasing suicide safety planning for at-risk populations, and more effectively using paid media. And the next slide here depicts the marathon, or SP 2.0 as we call it, and combining community-based prevention strategies with clinically based interventions to get after veteran suicide. As you can see under the community prevention work, we're utilizing current initiatives in the VA, such as our partnership with SAMHSA and the Governor's Challenge or Mayor's Challenge, and the work at developing state-level suicide prevention planning. There's also work with the Office of Rural Health and the Rocky Mountain MIREC initiative. It's an initiative called Together with Veterans, where VA chose rural areas with high veteran suicide and developed a pilot program to help the communities build veteran-led coalitions to address suicide in those counties or those regions. It was initially in eastern North Carolina, Montana, and Colorado. It's expanded now to several other states. And the VISN-wide community prevention pilots are also aimed at community coalition building and were developed off the current VISN 23 suicide prevention pilot. And some of you may have heard about that, where they went out and hired personnel to do outreach in the community and build community coalitions aimed at suicide. And we've changed, I think the title was Outreach and Education Coordinators. We've changed that title to Community Engagement and Partnership Coordinators. So what we're looking at doing is we'll hire these CPCs to do the work in the community and integrate with the 3 initiatives that I discussed previously. Additionally, we'll be pushing evidence-based psychotherapies in our facilities. Those that are highlighted in the VA DoD clinical practice guidelines, including cognitive behavioral therapy for suicide prevention and dialectical behavioral therapy, just to name a few. And we do realize that staffing is equally important, as you see down there in the box. We need to ensure adequate mental health staffing is addressed at each facility, as well as bringing facilities up to the recommended full-time equivalent of 7.72 outpatient mental health personnel per every 1,000 veterans in outpatient mental health. And on the next slide here, we realize the importance of enhancing the 2.0 effort through phased implementation across the U.S. and constant program evaluation to study strategies for ongoing execution after 3 years. We want to make sure we incorporate those lessons learned from business that we implement early in the process and take those lessons learned into rolling out the other implementation and transition, the other business. We want to utilize the request for proposal or RFP model, where business submit community-based proposals and access national telehub for the clinically based interventions. And Dr. Miller, our executive director, proposed a 3-3-3 phased implementation plan for each model, which basically is 3 strategies across 3 domains over 3 years. Community-based strategies are aimed at universal populations, and you can look at that population as all the veterans, while the clinically based interventions are aimed at the indicated and selected populations, or the some and the few veterans. And I meant to mention at the beginning of this presentation, feel free to ask questions in the chat box or whatever. I will address them at the end. So sorry for not mentioning that earlier. This next slide, I won't spend a lot of time on it. It's a pretty busy slide, but it shows how the community-based interventions will interact at the national, state, and community levels. So you have the National Suicide Prevention Program at the national level, and then you have at the state level the Governor's Challenge together with veterans and the other community-based suicide initiatives. And then at the community level, you have outreach to education. And then if we look at the suicide prevention team and integration, it's real important that we integrate the suicide prevention teams or our suicide prevention coordinators in the field and our community engagement and partnership coordinators that were discussed earlier. I think there's a definite concern on the SPC's part that the CEPCs would be taking over their duties of outreach, and that's not what we want. We want them to be working together in sync to combat suicide. So the SPCs will be working on things like enhanced care management for veterans at high risk for suicide at the facility, working implementation of evidence-based practices for suicide prevention, the VCO consults, and suicide prevention training, as well as community outreach. And the CEPCs will be building the coalitions in the community and integrating and facilitating community-based efforts to implement the evidence-informed practices in their regions or communities. So like I said, we see these two positions working together to implement the public health approach and reach all veterans across the continuum. I talked briefly earlier about the telehub for implementing evidence-based treatments for veterans at risk for suicide. So we're going to partner with the National Clinical Resource Hub to support virtual evidence-based treatments, align care with the VA DoD clinical practice guidelines, and then train clinicians in the various modalities that are in the CPGs, and then hire the clinical providers and support staff to implement and integrate the initiative within the CRH infrastructure. And the timelines for that you can see down there as well. Anchors of hope is real important to give people hope, and I think there is some really hopeful signs out there. One is there's a declining rate of suicide among veterans in recent VHA care with the diagnosis of depression. Veterans who initially reported suicidal ideations 3 months earlier while participating in VA outpatient mental health programs were 1.9 times more likely to report less severe suicidal ideation than before, which is really good. And then the third one I wanted to point out was women in VHA care had no increase in suicide rate or number of deaths from 2016 to 2017. So those are all very promising. And the VA continues to be a national leader in suicide prevention. I mean, people look to the VA and the suicide prevention program as kind of the gold standard. So I think we're headed in the right direction. But again, we need you, as we can't do the work without you. So I ask you to join us in action, and unfortunately, no single strategy in isolation has been shown to be effective in ending suicide. We must come together and address it as a larger societal issue, fueling the increased rates of suicide in our nation. We've listed there some things that you can do: promote safe training, which I'll talk about in a little bit. Apply data to guide prevention strategies and initiatives. Learn about suicide prevention resources, and then share with veteran employees and community partners. And you can have during employee meetings, you can have talks about suicide prevention and stress management, and self-care. And we look at resources. There's a lot of resources out there. I know that that with the resources that we currently have, a lot of people get confused or say there's they don't know where to go for them. So I'll talk about that. We have SAFE training, which teaches communities how to help veterans at risk for suicide. I believe that the SAFE training is offered at CFOI events by SPCs, because I know it's been requested to get our SPCs to those events. But it's also offered on the Psych Armor website. We have a lot of good online toolkits, and I would recommend that you go to the link down at the very bottom there, access all toolkits and resources anytime at. That link will pull up all the various resources. And Community Provider Toolkit is one that's very helpful and meaningful. I believe a great resource for not only community providers, but those who want to understand suicide prevention a little bit better and behavioral health and wellness of veterans. And then we have the toolkit for never federally activated Guard and Reserve. That one is really good for not just Guard and Reserves, but for anybody. Can go in there, and there's a lot of universal tools available in that toolkit as well. And then we have the Safe Firearms Toolkit, which is important. As I mentioned, 69% of our veterans are dying by suicide using a personal firearm. So we're definitely trying to get after that and make sure that we're addressing that. And those are the big ones I wanted to kind of pull out from the slide. And safe messaging is more for those that may be writing articles, and newspapers and various blog posts, other things. So there's some good recommendations on how to communicate about suicide. I'm sure everybody's probably heard of the Veterans Crisis Line, and that connects veterans in crisis and their families and friends with qualified caring VA responders to a confidential toll-free hotline. We also have chat. We also have text, which we're finding in this COVID environment is utilized quite a bit. So we want to make sure that everybody knows about that resource and can get that out to that information out to veterans. With this, we also have gun locks that we can provide to organizations that have a mission of helping veterans and to the various religious organizations that may be interested. But the gun locks are stamped with a VCL logo on them as well, and are free. And we can talk about how to request those at the end of this presentation as well. Make the Connection has some really good online resources to connect veterans, their family members, and friends with information and solutions to issues affecting their lives. And there's some really good videos on the Make the Connection portion of the website. And the veterans are telling their own stories and about how they got into care, what prompted them to get into care, and overcoming mental health challenges. So I urge you to look at that when you get a chance. And then finding a local VA SBC, I know that a lot of times trying to find an SBC or a suicide prevention coordinator, or just trying to find out where facilities are at, or locate a facility. This is a good resource for that. And if you look at this next slide, if you look for SBCs and you're looking for a suicide prevention coordinator to help with an event or just talk to help with a veteran, this resource located can help you do that. What you see in this slide is basically once you look up a certain area on the resource locator, it'll provide you with the actual information on the closest SBC. So you can call or email them for clinical support, say training or event support. As you see here, this is Fargo, North Dakota, and this SBC Tammy is pictured here. And then mental health mobile apps. There's some really, really good mobile apps out there. I encourage you to search them out, and they're under our resource page as well. But the Cognitive Behavioral Therapy for Insomnia, CBTI, is on there. We have the PTSD Coach is on here. That includes a template for a suicide safety plan. If you had a veteran who may be at risk, they can utilize that suicide safety plan that's on the PTSD Coach. and then some additional resources. And I won't go through them all, but the National Center for PTSD, the Columbia Lighthouse Project, the Columbia Suicide Severity Rating Scale, a quick assessment tool for, and it's easy to learn. They've got videos on there on how to learn to use it. It's a question screener, but basically will help you determine if somebody's at risk and help you send them to the right level of care. And then resources for training and education, because I know a lot of times people want more education on suicide or, like safe training I was talking about earlier. PsychArmor offers that, and they also offer some really good courses on a variety of topics related to military cultural competence. So if you have a new employee or you just have somebody who doesn't know a whole lot about military culture, there's some really good training on there. And then certifications offered for veteran-ready healthcare providers and veteran-ready organizations. The Suicide Prevention Resource Center, that's another good website with resources. Of course, the American Foundation for Suicide Prevention, we do a lot with them, partnering on lethal means safety and other things. So we've got a really good partnership with them. The CDC, of course, has some very good prevention resources, and then National Alliance of Mental Illness and SAMHSA. SAMHSA, we are currently partnered with on the Governor's and Mayor's Challenge, which I talked about earlier, and that's one, along with Together with Veterans, that the spiritual component that religious organizations can take part in and help out with the veteran suicide issue in their communities. So I'd encourage you to go to their website and look for the Governor's Challenge, Mayor's Challenge for their work and their partnership with us. For Together with Veterans, they've got their own website, and unfortunately, I'm sorry I did not put it on the slide. But Together with Veterans is, if you type in Office of Rural Health and Together with Veterans, it pulls up some information on that initiative as well. So a good way to get involved in your local community, these efforts. And that's really about it from me. I know it didn't take as long as I thought to get through the various slides. Of course, I'd like to open it up for questions at this time, and be glad to answer any questions or take any questions forward that I might not be able to answer, and bring some answers back to you.
Okay, thank you so much, Mr. Lantos, for that very informative presentation. And we will open the floor up now for questions and answers. If you could type your question in the Q&A box or the chat box, and as the questions are being asked, recite the question, and then you could answer the question, Mr. Lantos. We'll open the floor up at this time. Anyone have any questions?
I see one in the chat, in the Q&A chat box from and forgive me if I don't say the name right, Mariella Tone.
Okay.
What are your current plans and processes for community outreach, such as pastoral, ministerial support, outreach to churches? And that's a great question, and it's one that we're addressing through our Vision 23 expansion that we talked about, or Vision expansion, as well as the Mayor's and Governor's Challenge. How do we reach out to the spiritual community, the community of faith? Who's the point of contact for that? I know we've been working with CFOI and other organizations on that. But we've really been taking it to the state level and talking to them and the Governor's Challenge and Mayor's Challenge about the importance of the spiritual component, and that they need to involve the faith-based community in these efforts. So the individual states have been bringing in chaplains from the National Guard, as well as leaders in the faith-based community, and each state may have a different variation to that, but we've also done some work, I know, in our office on, or at least through the MyRec. We touched the project through the MyRec of cognitive behavioral therapy work with chaplains, teaching them how you CBT techniques, to get suicide. I know that there's been some efforts to in the visit expansion I was talking about earlier, to make sure that the outreach and education coordinators of the CPCs are trying to include in their coalition plans and bringing in the faith-based community. So I hope that answers your question.
Okay, and then we have a second question here. How do we get connected to Mr. Conrad Washington and the faith-based resources? Mr. Washington, you want to answer that, or you want me to answer?
Yeah, can you all hear me there? Sorry. So a couple of things. So at the end here, True's going to have a slide up for all the applicant, all the participants to take a look at our emails. So you can reach out to us, and so you'll get information from that way. We're also going to send out a bunch of information to you if you have not already downloaded prior to this event. So my team will send out some handouts, fact sheets, some information that Brad provided us. He had great information here, and also about our pocket guide. So stand by, you're going to get a lot of information. And I'll take this time as well to tell you that we're going to have another webinar next week. So, join us next week, and we're going to continue to do these things, probably at least 2 a month. So look out for us, and we can get added to our distribution list.
Okay, thank you, Mr. Washington. We have another question for you, Bradley. If you have suicide developed materials, who do you send the materials for review? I am a VBA suicide prevention manager. And this is for Serena.
Definitely. We try to absolutely cross-collaborate with this. Anything we clear through, we try to, hit every office that is interested or may touch suicide prevention, and get their review or their take on the materials prior to finalizing the product. We do a lot of work with MyRec. We do a lot of work within OMHSP. We do a lot of work outside of OMHSP to like organizations like CFOI and CMB and others that we like to get them involved in reviewing the information. So if there's if you want to contact me too, and if you want to be part of any review process, then please feel free to reach out to me, and I'll provide my information in the chat box here, so that you can reach me via email or phone to provide any information to me, so I can reach you.
Okay, and also, I think you just answered the last question here from Ms. Serena. How can I get a copy of your slide deck so she can reach out to you via email, internal email on the gal, and get your contact information, correct? Yes.
So I gave my phone number in the email. You can contact me there. If it's if you're within VA, of course it's releasable. I just can't release outside of VA because the clearance process was only for internal. So anyway, just to let you know. And then there was a question about can you talk about the role of VA chaplains in suicide prevention? I can get some more information on that. I don't know the role specifically. I didn't know if Mr. Washington could answer that or anybody on this team. I don't. I know they're a key player as far as providing support in in making sure our high risk veterans have somebody to talk to, sure, and getting them in a safety planning. But sir, do you have any more on that?
Yeah, I can jump in there real quick. So the VA National Director for Chaplains is Dr. Juliana Lesher. We have a strong collaboration and partnership as we reach out to faith-based organizations across the nation. So they play a huge role in suicide prevention. And as a matter of fact, they're actually rolling out new guidance and new strategic plans for reaching clergy. So you can reach out to me or my team, and we will connect you. And I will also add a couple of things while we have time to get everyone. I won't hold you up, but Brad mentioned about SAVE training, the suicide prevention training with the suicide prevention coordinators. Well, guess what? The Center for Faith, the office that we are in, we can coordinate that for you. Wherever you are in the nation, reach out to us. We'll make it happen for you because we have a list of all of those coordinators. We know who they are, and we can make that happen wherever you are in the nation. So please reach out to us. We can coordinate that training, which also we have clergy-specific training, which is like the moral injury, kind of like train the trainers. So as we minister, I know I have some pastors on the line and some clergy. Guess what? We need some help sometimes too, right? So we have our chaplains here to assist and provide some additional clergy-specific training for you. And the last thing I will say to you, and I want to hold you up, two things. What Brad is doing, what we're doing here in the Center for Faith, and what the VA is all about is two things: connecting community services to our faith-based organization and to the VA services, because we can't do it alone. The 20 million veterans, and the number of veterans that are committing suicide every day, we can't do it alone. So that's why we want to connect with you, and we want to connect you to community services as well. So reach out to us so we can, all hands on deck and make some great things happen in our communities.
Okay, and then we have a comment by Miss Michelle Kant. She says, "Thank you. Our chaplains have been such a great partner, and they have. We can contest to that." So, is there any more questions or comments anyone would like to add at this point? We do have our point of contact on the screen now. You can reach us at these. Here are our emails and telephone numbers where we can be reached. If you have any more questions after this presentation, you can send them to me or Mr. Washington or Mr. Morales or Mr. Walters, and we'll be glad to get back with you. We will, if we don't have the answer, we will try to get the answer for you. No more questions at this time. Mr. Washington, would you like to say a few words at this time?
Yeah, just a couple of things. I just want to thank Brad for taking time out of his schedule and sharing with all the participants the information that's available to them as they're out there on the ground touching the people's lives. So we appreciate you, Brad. And then the other thing I would share with everyone is that, there's a direct relationship between our faith, which is really means our hope that we have in our respective denominations and stuff into as it relates to the self-sufficiency and the road of recovery. So I think people now are realizing that faith plays a role. I kind of knew that some years ago, right? But now I think people are realizing that that faith plays a role. And all we want to do is bring that together with the resources that the Department of Veteran Affairs has as the second largest federal agency. We have resources all over the nation, over 150 medical centers. I mean, we can really do a lot, but we need your help so that we can connect together and be strong and build our communities so that no one is left without resources to make their lives better. And that means those risk factors that affect how we conduct ourselves, whether it's divorce, loss of job, or whether it's a protective factor like our faith or volunteering. We're here to help. We have a volunteer services section across the nation. If people want to volunteer, Sabrina Clark runs that. We can connect you with that. So whatever you need, reach out to me and my team, and we're going to try to make things happen in your community as we go forward. So you all have a great day and be blessed.
Okay.
Thank you.
This adjourns today's meeting. Thank you for joining us today. Stay safe.